Shopping Network, the shopping channel. My name is Carol. We have Dr. Will Kirby joining us once again with Neutrogena Dermatologics and a product brand new to the shopping channel. Excited to bring this to you all. It's the Retinol NX Wrinkle Filler. It's item number 431435. It's at an introductory price for you today. It's $65 and 3 payments of $21.67. So I guess with the retinol in here, this could be, over time, people's alternative to injections?
Well, that's a very, very interesting point because we're going to talk about, it's more the hyaluronic acid in here. That's the other ingredient that is absolutely true with what you're saying. But let's take a step back first, just a tiny little half step back. We talk about the Neutrogena Dermatologics line.
Yes.
It's the specialized professional division of Neutrogena, and it's a line that contains that stabilized retinol technology. 17 patents involved in it. But we call it Retinol Plus because there's always something plus. And in this product, this is called the Wrinkle Filler. I call it the Wrinkle Fighter because it's that stabilized retinol technology plus hyaluronic acid.
Right.
And I know you're saying, Dr. Kirby, who in the world knows what hyaluronic acid is? Luckily, you brought in a nerd today because I'll tell you. Hyaluronic acid is it's a fascinating substance. It's naturally occurring in our body. And you mentioned injectables. If you come to my office in Beverly Hills, a lot of times I do offer people injectables. And what we inject is hyaluronic acid. That's what people augment their facial lines with when they're getting deep, deep lines. And now Neutrogena Dermatologics has packaged that with the stabilized retinol technology to offer you hyaluronic acid in combination in this exclusive product.
So hyaluronic acid can hold up to 1,000 times its own weight in water?
Exactly, and I think that's where we have a nice little demonstration here. I think that's something worth repeating. Hyaluronic acid holds up to 1,000 times its weight in water. You can think of it as micro sponge technology. And what happens is it really plumps up their skin. As you age, you lose that hyaluronic acid, and that's why people get more hollow in their face, and they really, a couple areas in particular, nasal labia lines from the nose to the lip, from the lip to the chin, which are the marionette lines, the deep lines on the forehead, and another big area are the creases in between the brow, what we call the 11s. So those are the major areas where you get wrinkles and where you want to fight them, and it's the hyaluronic acid that you're losing in that area, and that's what Neutrogena Dermatologics really offers to apply to the surface of the skin to diminish the look of those wrinkles.
So, between that and retinol, it's a pretty good
product. It's the combination of those two together. This is a little dried sponge here, and I like to make this analogy. You can imagine that this is the hyaluronic contained in this product, and you can imagine this water here is just moisture in your skin. And when you put the two together, over the course of just a few minutes, it really plumps up very, very nicely. So it plumps the surface of your skin, and it really diminishes the look of those fine lines, even the look of those deep wrinkles in those problem areas.
My goodness.
It's a very incredible, I'm very passionate about this because it's an incredible product. It's new technology, and the combination of those two things together really make a product that we've seen wonderful clinical results with, which we'll talk about.
Do you apply this all over the face or just on the wrinkles?
Great question. The product that you saw earlier, the serum, that's a full facial product. And you apply a thin layer of that every single day. That's more, you can treat fine lines, wrinkles, but it's a prophylactic product, meaning that it also prevents their appearance over time. This is a product, we call it Wrinkle Filler, I call it Wrinkle Fighter. It's for people who actively want to fight those wrinkles that they're seeing on their face. And I tell them, take a really good look in the mirror at yourself and have an honest conversation and decide where you're developing those lines. Some people develop lines in certain places that others don't, and vice versa. So we talk, the areas that most people really notice are those frown lines, the glabella lines, also known as the 11s. That's what really bothers a lot of people. But the forehead lines bother them quite a bit. Lines around the eyes, the nasal labia lines, anywhere where you're seeing deeper lines is really where you should apply this product. And once again, a little pearl-sized amount, a droplet amount, that right there is enough to, I'll hold my hand real still.
It's quite hydrating, isn't it?
Very hydrating.
Beautiful.
And the clinical studies testified to that as well. So we'll talk about how hydrating it is. But it's a really, really nice product. Right away you feel, I can't really quantify this, but it's almost, you feel like a little spongy effect. It plumps up very, very nicely.
Look at that sponge in the glass. That's pretty cool.
And that's an example of what hyaluronic acid does.
Good demo. So this is quite different than from a lot of other wrinkle fillers that we have learned about over the years, isn't it? Don't you think? I mean, a lot of times the wrinkle fillers, they leave a chalky film.
Oh, yeah.
They're like a filler. They would just go in the line and fill it in. But this is like a treatment.
Oh, 100%. This is a treatment. It's a very, very new product. In fact, this has only been out for a few months. This is the first time it's ever been available on the shopping channel today. But it is exclusive, and it's a product that we really see those beautiful clinical results with the people who use this product have been very, very impressed by it, and that's why I'm so passionate about it. It's always nice to give people what they want.
Of course,
when they're worried about the aging process, it's nice to give them solutions to solve their concern.
So how often do we apply this then?
This you apply every single day, and once again, I like using the serum, the product that we featured earlier. I like using that at night and using this during the day.
Okay.
I think that's the easiest. Just like the serum, this needs to come in contact with your skin first.
Oh, okay. Then.
So now if you're using the serum during the day, well then conversely you could use this at night.
Sure.
But it's nice to flip-flop them, have one in the morning and one at night, coming in contact with your skin first, and the last thing should be your broad-spectrum sunscreen.
Okay, so that makes perfect sense. Dr. Will Kirby joining us today, and again, another fabulous product, the Dermatologics Retinol NX Wrinkle Filler, brand new to all of you at the shopping channel. It is $65. It's also on Easy Pay if you like, 3 payments of $21.67. So use it the opposite time of day in which you use the first item out of the gate, which was the Retinol NX Serum, and this is called the Wrinkle Filler. It's very, very hydrating. We saw the demo with the sponge. Do we have clinical results
absolutely.
To share with
we have a clinical study was done, so we have those statistics, and then we also have a few before and after pictures.
Great.
Just one application, 72% showed improvement in the appearance of crow's feet fine lines. And you mentioned earlier that it feels really hydrating. Exceptional
really
hydration
nice.
Lasting up to 24 hours.
Okay.
So just one application, you get that nice longevity over the course of time. Once again, you know I like 4-week and 8-week studies because the skin cell turnover. 90% showed improvement in the appearance of crow's feet fine lines after 4 weeks, and 81% showed improvement in the overall, they noticed overall younger looking appearance to their skin over the course of that time. Here's a picture 8 weeks. I don't love this picture because it really doesn't do this model justice. If you get up close to your TV and you take a look and you compare and contrast the forehead wrinkles on both pictures, you'll notice a very noticeable difference after 8 weeks.
That's true.
On the after. Also, in particular, the glabella lines, which are those frown lines, the 11s in between the brow, there's a very nice softening of those after just 8 weeks as well. So you get hydration very, very quickly, but over the course of time is really where you start to see that benefit after 4 weeks, 8 weeks. That's when you really start to see that very, very nice difference.
Very nice. So again, much like the Retinol NX Serum we started the show off with, you just need a little bit, right?
Oh, the tiniest little bit goes a long way. This should last you at least 60 days. And like I said, you can use those two products together. They're wonderful companion products to each other.
Nice.
If you're not using any anti-aging regime, it's a great way to enter into the market with a company that you know and trust. But if you're already using products that you like, well, maybe you want to add one or the other. And if you're using products that aren't working for you, I implore you, if they're not working today,
get rid of them.
Haven't worked, they're not going to work.
Right.
So you need to use products that do.
You know, so with the first item out, the Retinol NX Serum, we had the retinol and tetrol, right? And this is the retinol and hyaluronic acid.
You said that so well, because I know that's a mouthful.
Oh, no. So hyaluronic acid, again, holds 1,000 times its weight in water. And that's going to, of course, just help to plump up the skin because all of a sudden there's moisture that's going to be locked in. And the retinol, what is it going to do?
Well, the retinol increases surface cell turnover. And
right.
retinol, what's the phrase? You should adhere to my words here. I promise you, a retinol stabilized technology is imperative to any anti-aging regime.
Okay.
And if you don't take my word for it, ask any dermatologist. They will tell you retinol technology is phenomenal. Some of the retinols in the past either weren't efficacious because they weren't stabilized and they didn't last very long, or people didn't tolerate them. And now these days with this advanced technology, 17 patents on this product, that stabilized retinol technology is imperative to diminish the look of fine lines and wrinkles, softens, smooths, restores luminosity to your skin.
Nice. So I don't want our viewers to be confused with, say, exfoliators, because that helps to stimulate cell turnover too, but it doesn't do anything for lines and wrinkles, does it?
Absolutely. And as a rule, I always tell people, we'll take another step back here. I love to talk about myself, you know that. The word doctor, it comes from the word doctorate, which means to teach. And there's so much misinformation out there and just confusing information, and you're getting it from so many sources. And I tell people, keep your regime simple. You can always add other things later, but keep it very simple. You mentioned exfoliators. Well, exfoliators destroy that upper layer of the skin, but they don't do it uniformly. And that's why I really dislike scrubs and things like that. What does your body do if you scrub too hard, which almost everybody does? It increases sebum production, increases oil production, and it gives you a more oily complexion, which really, it doesn't really help a lot in the long run. So you need to use the proper product to increase that surface cell turnover. And the benefits of retinol, once again, it's not just my opinion, more than 2,800 publications in medical journals are testament to the fact that stabilized retinol are widely considered a gold standard in the anti-aging market.
Is it expensive, an expensive ingredient, retinol?
Well, retinol itself, it's not so, there is a price point associated with it.
Stabilizing it, then I guess.
The over the course of